Hi, I'm Dr. Bryan and welcome to the second video of my short series on frozen shoulders. Now in my previous video, I spoke about what a frozen shoulder is and what you can do for yourself if you do have a frozen shoulder. Now unfortunately, not all frozen shoulders get better by themselves. So in the next two videos, I'd like to tell you what your doctor can do for you if you do have a frozen shoulder. So let's get right to it. Now in my previous video, I used a frozen chicken leg to show you what a frozen shoulder actually is. So that chicken is in the pot cooking now. Let's see if it's done. It's good. Smells good. So let's poke it and see if the juices run clear. Yeah, a little bit overdone. Now speaking about poking, there are actually a couple of different types of injections that you can give into the shoulder for a patient with a frozen shoulder. I've already prepared a plastic model of the shoulder to show you in greater detail, so let's move on to the table. Now over here I've got my shoulder model and I've recreated the capsule using a very versatile piece of rubber. Let's just say that the shoulder model is extra safe now. Now there are two types of shoulder injections that are commonly used by your doctor. Okay, the first type of injections is a steroid injection, or some people call it a cortisone injection. Now the way this is done is that your doctor will identify the landmarks around the shoulder, try to see where the shoulder joint proper is, and through the skin, introduce the needle right into the shoulder joint through the capsule, and he'll then deliver a dose of the steroid right into the shoulder joint. Now this kind of injections are only given for patients who have got a lot of severe pain in the shoulder. Now some patients that I see in the clinic, they have such severe pain in the shoulder that they cannot sleep on that side, they cannot dress themselves, they cannot even eat because they are so distracted by the pain all the time. Now please note that the injection of steroids into the shoulder joint itself will probably not improve your range of movement very much at all. So if you are having a lot of pain in the shoulder, yes, I would certainly recommend injection of steroids into the shoulder joint. But if your main problem is that of stiffness, then a steroid injection may not be of very much help for you. Now the other thing to note as well is that this kind of steroids administered into the shoulder joint itself is totally different from what you might have in the GP, for example, who might give you a painkiller shot into the arm or into the buttock. This kind of injections needs to be delivered right into the shoulder joint for it to be most effective. So most GPs might not want to do this procedure in their clinic, so you might want to look for an orthopedic specialist who can do this for you. So the second type of injections is known as hydrodilatation. So in this procedure, what your doctor does is that through the skin, he introduces the needle into the shoulder joint, pretty much the same as the cortisone injection, but instead of injecting steroids into the shoulder joint, he injects a large amount of saline right into the shoulder joint. And what he does is that he does that with significant amount of force, such that the whole volume of saline actually ruptures the capsule of the shoulder joint. Now in theory, in this procedure, your doctor takes a large amount of fluid and pumps it into the shoulder joint, hoping that the capsule will then pop, just like how a balloon might pop if you blow it up too much. And also in theory, you might think that the capsule will then be in tatters after it pops. But in reality, I really do not think that happens. The capsule will probably give at certain spots, but most of the capsule should still remain intact. The second biggest issue of this procedure is pain. Now can you imagine you've gone to see your doctor because you're having severe pain and stiffness in the shoulder, and your doctor tells you, look, I'm going to take this needle, I'm going to take this big syringe filled with a lot of saline, and I'm going to stick it right into your shoulder joint, and I'm going to blow it up so bad that the whole capsule explodes. Now that is certainly going to cause a lot of pain, and really, in fact, that is the reason why this procedure tends to fail in a lot of patients. The pain is so severe that most patients will not allow the doctor to complete the procedure properly, and hence a lot of patients end up still having a lot of stiffness in the shoulder after. Now there are much better alternatives, and in my next video, I'm going to show you what alternatives there are. So there you have it. Those are the two most common injections that you can use if you do have a frozen shoulder. Now if pain from the frozen shoulder is your main issue, I would highly recommend the steroid injections. But if stiffness is your main issue, I feel that there are better procedures available to you. So please follow me across my social media platforms and you can learn more about different orthopedic issues and the treatment options available for them. So I'm Dr. Bryan Tan, and I'll see you when I see you.